Hello and good afternoon, everyone. Welcome back to The Empowered Patient. As we also already reviewed, I am going to be discussing The Empowered Patient with the amazing Claudia Cometta. She has started a wonderful company called Avanti, and she is going to tell us all about that. We are completely aligned in our goals and in our passion to help patients and to empower them throughout the healthcare world. And so, without further ado, here she is. Hi.
Hi, thank you so much for having me, Dr. Troso.
Oh, my pleasure, really. So I'm so glad that we were able to get this together. I know we've kind of been going back and forth for a while. So welcome, welcome. Tell us
Yes.
about your company.
Yeah. So I know it always feels like such a loaded question because I feel like we're all so passionate about the work that we do. So it makes it really difficult to verbalize in the most concise words. So I'll try
Sure,
to outline a journey in the quickest way possible.
sure.
But I am a trained pharmacist. So I worked in clinical pharmacy for many years, over a decade, and I did my thing. Then I didn't necessarily hate it. I also didn't feel super fulfilled, but I did my job. And then I was faced with an experience that I had not previously had, which was walking my father through his cancer journey when he was diagnosed with lymphoma in 2016. And
Yeah.
so before that, knock on wood, mostly bumps and bruises. We didn't have large, significant experiences in the medical system as being
Mhm.
patients. So this was my first time seeing the actual patient experience. And now I fully understand, obviously, why there's like such an interest in this field, because it was honestly terrible. It was terrible from A to Z. And
Wow.
I was so shocked at how terrible it was, and also so shocked at how disconnected I was as a clinician, as a pharmacist, that I had no idea. I had
Wait,
no
wait.
idea.
Let me
Yeah.
let me. I want to interrupt you a little bit because that's a very broad statement, and I'm not
Mhm.
being defensive, having been in the medical field myself
Mhm.
and knowing that there's so many problems. But tell me, what were the top three things that were so terrible? What were the things that disappointed you the most?
Just the dismissiveness, first and foremost, of what it felt like to be a patient and trying to express concerns, trying to feel seen and heard, even with my involvement. So, even with me being there, ultimately as a daughter and as an advocate, I could see how dismissed my father was. I also witnessed and fixed multiple errors. Weight being logged as double what it was, which of course, is a problem for chemo,
Oh,
obviously.
that drove me
Um,
crazy.
just and these, maybe look like or seem like insignificant errors, but they, can lead to bigger problems. And
100%.
also just documentation. I was reading all of the notes on the online portal. I would see, like 2 days before my dad ended up with a chest tube, the pulmonology fellow documented that his lungs were clear to auscultation. He never listened. It didn't happen, but it was, how it is in the default, but that's literally like, that's your field. This is your specialty.
Yeah,
How do you
sure.
miss like basic physical examination? So just this over and over and over was, and then of course, being on the, in the hospital ward with, on the oncology floor with, just super sweet volunteers coming by with like
Mhm.
cookies and, brownies. Like, can we do better? Like, this is really like, it's a sweet notion, but is it possible that we could maybe like feed these people something healthy? So just like, there were so many details of things gone
Sure,
wrong.
sure.
And I don't, and I, my husband's a physician, so I am a huge advocate of both sides. I don't think there's malintent
Yeah,
as a large whole on the other side. It's clearly not working. So in any case, I
agree.
know I'm loading up all the questions. Would you like me to take a break there or keep going?
No, I just, I thought it would be good for you to tell everybody about, some of
Mhm.
the biggest things that you saw as problems in the system because I'm sure most of the listeners can relate to that. But get back to your company,
Okay,
get back to
okay,
what you're
okay.
doing. Yeah.
I didn't want to like load up too many questions, follow-up questions. So in any case, I witnessed that for a year. My father ended up passing away the next year, and
I'm
I
sorry.
just felt a very significant and deep calling in a way I had not felt before. So
Mhm.
pharmacy for me was, it checked, to be quite honest, it checked all the boxes. I wanted to do good work. I wanted to help others. I wanted to eventually have a family. I needed some flexibility, and I felt like it just checked all of the boxes. I was good at chemistry, and so it
Mhm.
was very analytical, that decision. The decision to do what I'm doing now was like born and created out of this experience of,
Mhm.
I need to do for others what I did for him, because even though maybe it didn't feel like a success at the time because I still lost him. I know it was a success with the amount of support I was able to give him and how he felt through the process because I was there.
Sure,
And
sure.
so I knew like I had to do this work. I didn't know how to run a business. I didn't, and I'm sure you can understand from being in healthcare, like
Yeah,
we aren't taught these things.
yeah,
Maybe the tide is shifting. I don't know, but when I was in school, that was not the tide. So
sure.
we
You
were
know, it's
taught.
funny, we're very aligned even in just that. The title of my company, one of my companies, is called Winning the Cancer Journey, and people often say like, "Well, you don't win cancer," but you're winning the journey because exactly what you're saying, that, even if we can't cure everyone, maybe I can make everything easier, more palatable, safer space for patients and, have them have the best experience and the best possible outcome that they can have. And to me, that's winning the cancer journey.
Yes.
So,
Yes
yeah.
to all of that. I absolutely, I would say I have also had a paradigm shift throughout this whole process of watching that, feeling like it was a battle I needed to win and feeling like a failure because I didn't win it for him and on his behalf, and then realizing years into it that it really is about people having support, people feeling seen, people feeling heard. We all obviously have an end date, like we have an expiration date,
Right.
and so we can't, like, even seeing immortality as the end goal doesn't make any sense. So but how can we make this life that we have with the
Right.
time that we have the most peaceful and serene, and all of the things, like how do we make it the best possible, and that's ultimately what I feel like I'm doing.
That's wonderful. But still, tell us the company. So, tell us, how would somebody work with you? Let me just put something up here for everybody else.
Yeah, so
So,
it's Avanti Health Consultants, and I actually rebranded not too long ago because it was initially Peace Advocacy Group, which I still resonate with the word peace. But what I ultimately wanted to do was bring in a lot of my roots in Italy to the company, and specifically Avanti means forward, and that's how I feel like I'm moving with my clients. Is
mhm,
how do we go from a feeling of stagnation and even regression to moving forward in the way that is most aligned with their goals? And so that's what we start with. So basically, people find me from a lot of variety of different places online, content, you do a lot of content, word of mouth, all of the things. And ultimately I'm meeting them where they're at. So that first call is really about, who are you? How can I help you? Where have you been in your journey? Where are we at right now? And where do we want to go? And they're
mhm.
guiding that ship. And I am there as a navigator. I actually tell people a lot of times I'm kind of like the general contractor, right? Like I am the point of contact.
Right,
Although I don't know that there's like a ton of emotion
right,
connected to contracting, but although I'm sure they're amazing people, but that's kind of the structure where like I am the go, like I'm the person. I am available to my clients 24/7. So if there is a question, a problem, something they didn't remember from a visit, there just isn't that person. As much as I think primary care can be that person, there still is not, sometimes in concierge, sometimes in direct primary care, but it's still like, okay, but I'm also on the calls with their specialists. Like I am involved in all of it. And so I really do, I mean, I go deep with my clients, which means
yeah.
I keep a pretty small panel, but I go deep. So that's kind of what I do.
So let me ask you a question. As a physician who has left academic medicine, I'm now doing some concierge work myself, and I've gotten a kind of mixed response from other physicians. Oftentimes, if I make a phone call and just discuss my thoughts on the case, they're fine with it. I haven't found that many physicians are open to having me on the call in the consultation room with them, though. I don't know if it's because I make them nervous or they just think it's unnecessary. They're afraid I'm going to contradict them. I don't know. So I would be interested to hear what your experience with that has been.
Yeah, I haven't had a problem, but I also understand where there, where I lie in the hierarchy. You lie more peer to peer. I lie, a little under them. Maybe that is the difference between their perspective,
Mhm.
difference between us. But I basically I set it up as if I am simply a part of the team. When I'm on a speakerphone call with at an appointment, or if I'm actually at the appointment, I'm sitting completely quiet until the end. So I don't interrupt. I'm not really um changing flow of the conversation the
Sure.
way it would have organically been. But at the end, we already know an intention and a goal for the appointment because we've discussed this, my client and I. And so by the end, if there are remaining questions that I don't feel like have been answered, if there's more information the physician can benefit from that
Mhm.
I don't feel like has been said yet. So that's kind of where I get involved. But I also tell my clients, if at any point in the middle of that appointment, you
Mhm.
feel like you don't feel well enough to answer the question, or so sometimes my clients will just say, hey, Claudia, can you take this one? Like either they like, who knows how you feel in that moment.
Sure.
But then I'll take over at their cue. Otherwise, I'm basically just there observing, listening, taking notes until basically the end, and I'm ensuring we're wrapping up, dotting all the i's and crossing all the t's. But
Mhm.
I understand that there may be a slight difference just
Sure.
because of the hierarchical difference,
Yeah.
between us.
I mean, my intention would be essentially the same, but I think that you're right because I am a physician. I probably need to have a deeper relationship or a well-known relationship with the other physicians so that they know to trust that I won't interfere. But because it's personally, it's really it's about the patient, right? It's
Mhm,
not about
mhm.
my opinion or winning an argument or anything like that. It's all collaborative. So, yeah. But so I understand you wrote a book not too long ago. Also, what
I
is it
did.
about the same topic?
Yeah, so I, had been doing this for years. I started my company in 2017 and realized that because of the type of work that I do and because of the quantity of patients that I see is just so small, I wanted to share more of my perspective on the healthcare system that could benefit more people. So the format and the platform for that made sense to be a book. And so I worked with a publisher and I got out a book actually this last February on World Cancer Day,
Mhm.
um, intentionally to honor my father's journey. And so it's called Patient Empower Thyself, which of course is like, could we you and I be any more aligned on that terminology? But so Patient Empower Thyself, and the whole goal of it is not to be a checklist of like, here's what to do when you go to your doctor's appointment. I really think the power is in the paradigm shift. So how do we see things differently than maybe what our parents and our grandparents taught us, which was, go to the doctor, sit quietly, be passive. They know more than you. You are just to listen, take the piece of paper with the drug, take it to the pharmacist, just be quiet and take a seat, right? And I just don't feel like that's helping anybody. And I don't think
Right.
it's helping the doctor either, because
Sure.
if we don't have this engagement and collaboration, how in the world, there has to be a meeting of the extreme expertise of a physician. And like I said, my husband's a physician. I watched medical school happen because we've been together since high school. So I understand and appreciate the level of knowledge that you
Mhm.
guys have. And also, I understand and appreciate the level of expertise patients have on their bodies that we don't live in it, we don't
Right.
feel it. And so, unless we bring those two together very collaboratively and engaged and activated, it's not going to work. So it's
Sure.
really a paradigm shift of let's move from sort of passive recipient of healthcare to a very activated. And that's not a like disrespectful or now adversarial thing.
No.
It's very much a let's become part of the conversation. Like let's
Yep.
come to the table, right? Like let's not just
100%.
yeah. So that's
I agree with you. In fact, I have a book coming out that has comparable type of advice, but from a slightly different perspective,
hmm.
obviously from a physician. The first book is about mostly about oncology care specifically. But tell me in your book, tell me what are maybe three things in there that you do suggest to patients that they should do to help empower themselves.
Yeah, the book really starts out with a contextual understanding of the medical system. So, you and I, and you even deeper than I, know what happens in the background of medicine. And so it's really just providing that contextual understanding, which I think we all need to know. Like we can't navigate any system in our lives without having any idea how that system works, right?
Exactly.
So it's just kind of a not super detailed, but detailed enough understanding of like what is a resident, what is a fellow, what happens when you're in these teaching hospitals and 18 people are coming in your room, and how do you navigate that, and so that's the
Love it.
first point is understanding contextually where you even are, right?
Yep. Sure.
And then also
I'm going to interrupt
yeah.
for 1 second because it's funny. As a doctor for so many years, it didn't even dawn on me that patients wouldn't necessarily know who was walking in the room, what their role was, and who they should tell what to, and who was going to make things happen for them, or what have you. That's so great that you bring it all the way back down so people can really understand specifically what's going on in that hospital.
Yeah, and I, even as I wrote it, I was hoping like I hope this isn't too elementary. And I've had,
Yeah.
multiple people tell me I had no idea that's how it worked. And we do just have this assumption that everybody gets this, but it's because this is where we live. This is how
Sure.
we work. So people don't understand that and need to. So for many people who did understand that, that part might feel elementary, but I think it's maybe a good review.
Hmm.
And then I talk about a lot of my own paradigm shifts. So asking questions, giving yourself permission so you don't have to wait for permission for somebody to do something. I talk a lot about how, like when we grow up, we're waiting for our teacher to give us permission, our parents to give us permission. Like we just work on permission.
Hmm.
And you don't need the permission to ask a question or to speak up if it's a medication that's being discussed that you don't feel aligned with or you don't want to take. Like you don't
Sure.
need permission from anybody to say that. Like just say
Right.
it. And then I talk also a lot about, and this might, resonate with you as well, is in, the patient oncology world, there's a lot of, I'm going to fight this, I'm going to win. And we talked about this like a second ago. And
Hmm.
I was that person too with my dad. Like I'm going to win, cancer picked the wrong girl, all of that verbiage
Right.
that I got sucked into myself. I talk a lot about how this is not helpful because we are now feeling like and talking like we're entering into a battle, and in a battle there is only one winner and one loser, and so we're setting ourselves up for just this terrible journey, right? Like we're always fighting, we have our boxing gloves on, and then we're fighting our body, and that none of this feels like, it doesn't feel good. And so how can we instead see not only our medical team but also our body as an ally? And
Right.
maybe there's messages there, maybe there's something that needs to change in your life, maybe it's something emotional, maybe it's something dietary, maybe it's all the things. And what if we saw it instead as a message, and like our body's trying to help us, rather than I'm fighting this thing that's
Right.
inside of me, and I'm trying hard not to lose this battle. And so it's a lot of discussion like that, paradigm
Hmm.
shifting around how we approach health
Yeah.
and healthcare.
I also think that, you know, with the winning and losing battle thing, it's also a matter of reframing what exactly the battle is,
Hmm.
right? And
Hmm.
so if the end game is always going to be, I'm going to beat cancer, sure, that's okay in the beginning if you're at preventative treatment or you're at adjuvant or there's a high chance you're going to be cured. I completely agree or understand why people would say or feel that way. But if you have recurrent cancer, if you have cancer that's, has spread to other organs and the chance of cure is not necessarily straightforward or even possible, you have to reframe what the battle actually is. The battle's not necessarily that I'm going to drive myself into the ground until I try and beat this cancer. It should be to fulfill your life and to have all of the things in your life that help make you feel like you and help make you feel like you're accomplishing things and making meaningful relationships and all the things that make a fulfilling life. So I think that, and I've tried to impart that to some of my patients, and sometimes it's hard for them to hear because they don't want to give up the battle to beat the cancer. And I'm not asking them to. It's more a matter of sort of reframing it as to what that battle looks like and what the end result should look like. And that's sometimes really hard for people to listen to.
Yeah, I do think there is an initial feeling of, yes, I do want to win this, I do want to beat this. But yeah, I do feel like I took that on myself. So this is not, this is not
Yeah,
some excessively enlightened me, better than everybody else. Like I did that, and it was just a very struggle filled journey. And so I learned afterwards that there could have been a lot more peace along that journey if
sure.
I just understood things better, and I understood, causation and root cause and all of those things better also.
Hmm.
And like, what could I have helped my dad with that I just didn't know? I only knew, what the very little that I knew from pharmacy school, from the physicians that I knew. And so in any case, that's the book really is about how do we think a little bit differently? Not that my thinking is right, but how do I spark some curiosity and
Sure.
shifts for people so that
Yeah.
they can find their own way
Hmm.
in finding peace.
No, I really sound like I have to read this book myself, and I highly recommend it to others if based on what you've been telling us. For anybody who hasn't noticed, the QR code to take you to the Amazon link for her book is up on the screen in the upper hand corner. So tell me, any other things that you'd like to discuss with our patients and our clients and our audience today?
Yeah, I really appreciate you going through all of this with me. I do think the book is very worth it. Obviously, we're all biased about our own books, but whatever, for $16, probably 13 now. I don't know. Amazon's always running a deal. I do think that there is quite a bit of value there. But what I would say is to people, is you have, if you don't feel like you have the permission right now, please
Mhm.
know that you do. And if you need to lean on somebody else to give it to you, please do that until you're able to give it to yourself, because
Sure.
you have to be an activated part of this team, and your medical team. If there's something that needs to change in your life and the Western medical system isn't providing it to you, you're allowed to augment. This
Mhm.
isn't an all or nothing. You
Right.
can really have a holistic team that works together. And so I think mostly the message is hope for people who feel like they have run out of hope because maybe they haven't found the clarity in what they need. There are resources and tools out there. So it's just a matter of giving yourself the permission to find them and use them.
That's amazing. I'm going to put your banner up here again so people can see your website. So if anybody's interested in working with her, it's right here on the bottom, www.consultavante.com with an I, not with an E, how I originally spelled it. No, and where are you located, by the way?
Geographically in Florida, but my clients are across the country. Yeah.
That's wonderful. That's really great. Well, I wish you all the best in your company and in the publication and the spread of your book. Sounds something very important. I will definitely help recommend it as well. And I want to say thank you again for joining me today. It was really wonderful getting to know you a little bit more and about the wonderful work that you're doing. Thank you.
Thank you, Dr. Trosa.
Take care. Bye. Bye, everybody.